Hello, I'm Dr. Sangeetha, Medical Director and Chief Consultant of Coral Advanced Fertility and Women's Care. I'm practicing in Bangalore since 20 years. GSM, that means Genitourinary Syndrome of Menopause. It happens due to aging of ovaries. There are no more follicles, eggs producing the required hormones to keep the lady young and keep her skin and the vagina healthy. So this can lead to various problems after menopause. Menopause is cessation of menstruation after her reproductive age. So after menopause, the hormones decrease to very low levels. So these hormones, feminine hormones, like especially estrogen, it is very essential for the female to keep up her healthy vagina, healthy skeletal system, healthy cardiovascular system, and also it can affect her mentally along with this physical changes. So managing menopause, genitourinary syndromes of menopause only is definitely a very big issue amongst the gynecologists. So when we specifically talk about genitourinary syndrome, so we talk about all the symptoms related to genital system or the urinary system. Because of the lack of hormones, the skin becomes thin, weak, less vascular, and it can lead to atrophy. That means all the cells might get shrunk. She can also have urinary symptoms because there is lack of support. There is lack of collagen in her vaginal wall, which has to buttress or support the urinary sphincter also. So the muscle might get weakened. The collagen fibers are going low. They are becoming weak. There is less elasticity, and there can be less glandular activity. So it leads to dryness. So there will be dryness, symptoms related to infection, symptoms related to urinary incontinence. So she'll have urinary leakage whenever she coughs, whenever she lifts heavy weight, whenever she walks for a long distance or running. So now most of the females are living up to 80 years, 90 years. So we imagine after 45, 50, post-menopause, still there is half of our life left. So we don't want to lead a very unhealthy life suffering from all these things. Definitely you have to consult a gynecologist and share your problems, get all the investigations, evaluation done, get a minimal cancer screening done along with other medical and physical examinations. So once you rule out all the medical examinations and physical examinations, like when your diabetes, hypertension, thyroid, everything is been treated, we'll have to treat your infection, we'll have to treat your symptoms, we'll have to just advise how to improve the vaginal health or urinary tract health in these postmenopausal women. So we have so many things like lifestyle changes, life coach, and as I already said, you have to treat other accompanying disorders. Along with that, the specific treatment, some related to what symptoms she is presenting with. For dryness, we'll advise something, for infection something, and they will have difficulty during intercourse, or there will be dryness, there will be pain. So all these things will be addressed differently according to our symptoms, and we have from non-hormonal treatment to hormonal treatment. Of course, patients with breast cancer should tell the doctor, keep in mind that she has to just give all the information, not to hide any cancer history from the doctor. So you will have non-hormonal to hormonal, and also now there is a very special treatment called laser therapy. So we just apply the laser energy inside the birth canal so that the surrounding canal, the surrounding wall of the vagina, everything is rejuvenated, they become healthy. How? This laser stimulates vessels so that there will be neovasculogenesis, new blood vessels forming, new nerves forming. The collagen becomes healthier, there is new collagen formation. All these things just revert back the vaginal wall to the younger age so that it again starts supporting the surrounding system like urinary system, and the patients will just get all the benefits of this laser therapy, as in like you get the vaginal rejuvenation, you can get rid of repeated white discharge, you can sometimes mild prolapse can be treated, and definitely stress urinary incontinence can be treated with this laser. And along with that, we'll be just educating her how to care for her genital parts and some Kegels exercises along with other medicines.